going to turn next to Christie Hager. Christie is a longtime friend of mine going back to our days on the steering committee of the health law section of the Boston Bar Association back in the 1990s. She is currently the regional director for the U.S. Department of Health and Human Services for the Obama administration here in Boston, and in that position she represents Secretary Sebelius within the 6 New England states. Prior to being regional director of HHS, Christie was a lecturer at the Harvard School of Public Health in healthcare policy, and prior to that, she was the chief health counsel in the office of the Speaker at a sort of boring time in Massachusetts healthcare annals. That was during the enactment of healthcare reform. She was chief health counsel for the Speaker of the House of Representatives. So, Christie, I'm going to turn it over to you now to talk about implementation of healthcare reform at the federal level.
Thanks, Tom. Thanks for that introduction. And I'll say too, Tom mentioned my most recent experience with PFAS. I didn't need these when we started working on health reform in Massachusetts in 2004. And I have several pairs now. But it is a particularly exciting time. It was an exciting time here in the state in the period leading up to the 2005-2006 really historic legislative session here. We have continued to experience a great deal of adventures in implementation of health reform. So our adventures on the federal level should be something that we're all prepared to work through together. I do hear greetings from Secretary Sebelius, and I am her, as Regional Director of Health and Human Services, I'm her Senior Representative in the New England region, which is very neatly defined as the 6 New England states, for which I'm grateful when I hear my counterparts talk about regions such as ones that are California, Nevada, Guam, Hawaii. We have some particularly unique opportunities for regional collaboration and strong relationships here. But it is a very clear charge from Secretary Sebelius as a former governor, as a former state commissioner. It is very important to her that we represent her in establishing and strengthening relationships between the federal department and the states. And that's not just the governors and their health and human service cabinets, but also our non-governmental partners in the states. And again, that's nothing new to us here. I thank the leadership of MassBio for inviting me to be here today. I'm grateful for the opportunity to be here with all of you. I'm also grateful for the opportunity to be in Massachusetts today, much less Boston, just a short walk from where my neighbor and I live in the North End. I have, in the past, not quite 9 months since I was appointed to this position, put about 10,000 miles on my Ford Federal Chevy Impala, driving just around New England, and being out, meeting with folks where they live and work, around focusing very much on implementation of the Affordable Care Act, but indeed working with them also on the many programs and services that the Department of Health and Human Services has been working with our partners in the states on all along. Very strong theme in the implementation of the Affordable Care Act is innovation. We are also fortunate here in New England that innovation, we've been innovating for so long that it's the way we do business. So the theme of innovation and the importance of innovation in the Affordable Care Act is something we're well familiar with. The Affordable Care Act relies on innovation. It, in fact, requires innovation. And when we worked on health reform here in Massachusetts, so many of us together, we didn't have nearly the tools available that are provided now by the Affordable Care Act. There is funding available. There is a clear agenda of providing access to quality health care that's affordable and accessible and based on the best information and knowledge and evidence and value, and a necessary alignment now of those goals along with payment reform that is really going to, I think, inform and support the work that you all have been
have started long before the Affordable Care Act was enacted. And as Secretary Sebelius herself recently wrote, this is not just about writing bigger checks for more services and for more care. This is about an investment. It's an investment in the relationships between the public and private partners, and it's an investment in industry and in services, protections for patients and for consumers. The Therapeutic Discovery Project alone, $126 million, just in Massachusetts, to over 500 companies, is certainly a clear sign of the commitment that the department has in encouraging and supporting the innovation that is a potential here. And know that the conversations we have here, and the discussions we're having, and the work that you all are producing is being very carefully watched by Washington. And I am pleased that I'm in the role of being able to highlight that, so that we can make sure we share it with the rest of the country. But such vast reform certainly comes with the need to work very closely, to understand what may have seemed clear. We've certainly learned here that it's taken years, and we're still working on how best to implement and how to be most effective in implementing the provisions of our reforms here in Massachusetts, and now overlaid with those as the foundation of the provisions of the new Affordable Care Act. It's going to require a lot of reassurance that the change that's coming is positive, that we all understand what that change consists of, and what it's going to mean, and also that we're all working together in the best interest of patients and consumers, and that we understand what the cost would be in any efforts to undermine some of the provisions related to all of the seniors, over 1 million Medicare beneficiaries just in Massachusetts alone, who will be receiving preventive services, including annual wellness visits, increases in discounts and brand name prescription drugs, annual flu shots, annual colonoscopies, mammograms for free, for the first time in the Medicare program, for free, as well as the benefits to small businesses, to tax credits. I already mentioned the Therapeutic Discovery Project, clear commitment on the part of the department, grants and credits to you in supporting the work that you do. So as we go forward, I'm looking forward to hearing from the others on the panel and some questions from you on how we can make this work best for us going forward.